Hi, I'm Dr. Ronny Tan, consultant urologist from Parkway East Hospital. My subspecialty is in the field of andrology, men's health, and urological prosthetic surgery. The prostate is a walnut-sized gland, which is found at the base of the bladder. This is where the bladder is a prostate. So the prostate produces the seminal fluid that a man ejaculates. As a man grows older, the prostate enlarges in size. Once a man crosses the age of 50, 40% of men will actually have these symptoms. And the percentage increases up to about 70% once a man hits the age of 70. So frequency of urination is one thing. During the day, they find that they need to interrupt their usual activities to go to the toilet. And the other thing is the need to wake up in the middle of the night affects their sleep, so affects their quality of life. So the problem with enlarged prostate causing symptoms is that the bladder would have to work harder. As a result, the bladder can tire out, and then the patient will be more prone to urinary tract infections. There's also risk of failure of the bladder, resulting in kidney failure. When a man comes to us for urinary symptoms, we do an examination called a digital rectal examination, where we actually feel for the size of the prostate as well as the consistency of the prostate. We also get him to do a urine test known as a uroflowmetry test. This test will ascertain how fast he passes urine and how much urine is left behind. We do an ultrasound to check the kidneys, the bladder, and the prostate, and also we also offer blood investigations. As with any conditions, we start with behavioral modification. If the patient finds that it's due to his diet, we try to change some of his diet. Medications, oral medications are the first line of treatment that we'll give to the patient. So surgical treatment options, traditionally we have TURP. Transurethral rectal prostate, or TURP, is done using a scope which we place through the penis into the prostate, and we use an electrical knife known as a diatomy to actually cut the prostate. So what we are trying to do is to create a channel so that the urine can flow out from the bladder into the urethra and pass out of the body. Similarly, the green light laser is also performed via a scope that's placed through the penis, but instead of using a diatomy or electrical knife to cut, we actually use the green light to vaporize the prostate. So the difference is, after the procedure, there will be no tissue that's sent off for histology to rule out cancer, whereas in TURP we have what I call the prostatic chips, or the pieces of prostate that we slice out to send to the pathologist. So UroLift is a placement of these implants called UroLift. The implants will actually push aside the prostate that's obstructing the flow of the urine. Unlike TURP and green light laser, we actually damage the tissue by removing the tissue or vaporizing the tissue. In the UroLift, we actually do nothing to the tissue except we just draw them apart.